All right, welcome back, folks. For those of you that have not seen the pre-symposium chat, Gabriel is one of my favorites. Well, they're all my favorites, really.
No pressure.
No pressure, yeah. Gabriel is the CEO and founder of a business called SejutaKG, and what they're doing is actually super interesting. I won't give any intro. I'll let you do your presentation. I think you do it far better. We will have time at the end for some questions, so probably 5 to 10 minutes. So feel free just to drop them in the Q&A box throughout the chat. But yeah, Gabriel, tell us how you are mass coordinating the entire population of Malaysia to look after themselves better. Take it away.
Thank you so much, Ben. Let me just get my screen share up and running. Okay, great. We just came away from a very, very interesting meeting at the Ministry of Health. A lot of good data points, good sharing, good learning, and can't wait to download that to our team later. But let me share screen right now. Okay, context. In the movie, well, I guess we call this part the trailer, but it's definitely not as exciting as a trailer, as a normal trailer. Context of what we are trying to deal with: obesity, and obesity comes within the general category of non-communicable diseases. And here are some key WHO statistics for us to know what we're dealing with here. Non-communicable diseases kill about 41 million people each year. That's 71% of global deaths by far. Majority. 77% of these deaths are in low to middle income countries. 15 million people between ages to 30 to 69 die from a non-communicable disease, and 85% of these premature deaths occur in low and middle income countries. 2.8 million people die every year as a result of being overweight. And the WHO divides risk factors for NCDs into two: modifiable behavioral risk factors, MBRFs, and metabolic risk factors. So modifiable behavioral risk factors, my preferred acronym is WTF are you doing? Basically, is physical inactivity, poor diet, tobacco use, alcohol use, and these are obviously things you can change. That's why they're called modifiable. And these, then the other risk factors are raised blood pressure, obesity, hypoglycemia, high blood sugar, hyperlipidemia, high fats. And as you can see, there's definitely some interplay between these two, of one leading to the other. But for reasons of intervention, WHO divides these two risk factors. Now, why are we talking about all these things? It's because we are focusing on modifiable behavioral risk factors with a particular insight that comes from working with Dataswift, a decentralized data network like Dataswift. One, the insight that we have is that verifiable behavior lends itself to being modifiable. From an enforcement standpoint, it's pretty easy to see if I'm a habitual litterer on the bridge that I cross every day. The next day I see a CCTV camera in my face, I will definitely stop doing that because my behavior is suddenly verifiable. But from a non-enforcement standpoint, that's also certainly the case, especially if you have people with a stake in your betterment. So we enable individuals to benefit from this trait of human nature in their journey to weight loss or better health by providing them with verifiable data, behavior storage as data. And that leads to the second point, which is that we provide visibility of that data to stakeholders who can help them on their journey to better health and who are consented to by the user through a decentralized and privacy-preserving network. So whether it's your supporters, your family, your clinician, dietitian, pharmaceutical, or a pharmacist, if these are the ones that can help you or are invested in your betterment. So you can choose to share your data with these stakeholders for your benefit. So the next thing, and the third thing, is delivering a personalized intervention at scale for all socioeconomic backgrounds at the most affordable cost, our holy grail. As you know, in obesity, personalized intervention is pretty expensive, and we hope by having a set network such as this at scale with verifiable behavioral traits inputted into data accounts and shared through data passes, we can realize this dream of having a personalized intervention at scale at the most affordable cost possible. Thus ends the trailer, and we proceed now to the main presentation. And that's SejutaKG. Our tagline is "Get Lighter, Be Healthier," and we are a community weight loss campaign plus platform. One thing we are not as a program, although we do have some features of program. We want to bring together all programs that can help our users onto the platform. But at the core of it, we are still a healthy campaign, a health and weight loss campaign. So introductions. For myself, I'm from the Triune Center for Social Engagement. We have been supporting coaches, trainers, startups, and nonprofits for about 4 years now through in their administrative needs, co-working venue. It's through this experience that I was supporting nonprofits that I found my passion for this cause and started SejutaKG. But all credit due to Mayor Mick Cornett, whose campaign in Oklahoma City from 2007 to 2012 to lose 1 million pounds. He is the one who is the direct inspiration for this campaign. And the impetus for that campaign was because Oklahoma City had been declared the fattest city in the United States by Men's Health magazine, which is quite an achievement. So yeah, all credit is due to Mayor Mick. This is our specialist panel. We have Dr. Chow. She's a clinician, also a weight loss advocate for children. She has successfully transferred a program to a large hospital chain. Professor Wayne Chi, head of the committee that finally undid the damage of our food pyramid after many years. She created our Malaysian Healthy Plate program, which replaced that unhealthy food pyramid. And we still have an opening for a mental health specialist who can advise us on active engagement and psychological transformation. As for myself, a little bit about me. I am a socialpreneur, supporter of socialpreneurs. I studied market failures at LSE a long time ago. I'm glad I can come back to it. And I'm a personal data and personal health advocate. So SejutaKG brings together all my passions into one singular goal. Around this 20 years experience in branding, advertising, and events organizations. So she heads up our social media and events engagement. So a little bit of a screenshot from our website. In a nutshell, what are we providing to our users? We're providing three things, 3 M's: mindfulness, motivation, and merchants. Mindfulness is the key feature that we're trying the key trait that we're trying to imbue in our users, which is basically being mindful of what you eat and your weight every day. And that probably is a Herculean task given how much distractions there are, but we think it's worthwhile. We provide that in form of a tracker and a way for your support group network to interact with you to get to your goal. We also provide motivation in the form of a platform for friends and family to give their support, and prizes through sponsorship from companies who are aligned with our goals. And that brings us to merchants. And since obesity lifestyle is obesity's weight is all part of your lifestyle choices you make, we have to surround our users with healthy merchants with compelling offers and discounts that can help them on their journey to good health. Underpinning all this, needless to say, is our good friends and partners, Dataswift, without which we could never, absolutely not have done this. It's providing a data passports in such a way that the user is confident and incentivized to update himself is exactly what we want to do with mindfulness. It's exactly how successful weight loss programs such as Weight Watchers and whatever and others have built mindfulness. But this time we are really doing it at scale for people who don't have the budget or the community to help. So underpinning all this is a digital SejutaKG digital data passport, which helps us users keep track of their health progress and maintain their vital information in a database owned and centralized onto the user. And this allows them to get certified and allows them to provide certified, verified health data to others who are more confident in their advice and recommendations to them because that data is so holistic. So what exactly do we mean by mindfulness? It's very simple. we basically try to catch people doing something right, hopefully more right than wrong. Within our 7-day mindfulness program, we would highlight the upward and downward trends based on 0 interventions, basically what they were eating normally. And we will highlight the risks and dangers if the weight was climbing at a certain time. And we would highlight the benefits of the user's choices when they went down at a certain time. So basically, almost semi-painless intervention of highlighting to the user's good habits, good behaviors, and highlighting his bad ones. And basically just encouraging him and nudging him or her to follow the good ones. And since weight loss is statistically has been proven to be mostly about diet rather than exercise, this is crucial to get to their goals. This is our big cheese motivation. All expenses paid trip to Turkey for 2, one for the user and one for his or her supporter. So they're incentivizing the support network to get along on the ride and make sure the user reaches his goals. And that's exactly all in our website. It's going to be in our materials, in our collaterals, our advertising. We are addressing the supporters as much as we are addressing the users, because anecdotally as well as research-wise, we find there a lot more traction when the user is kind of surrounded by people engaging him or her on this goal. As for the merchants, we have 5 categories. We are currently mostly focused on the first 2, onboarding merchants and meals and plans. Onboarding merchants are those such as clinics, dietitians, pharmacists, where they can do a proper baseline, responsible baseline for the user, get them started with a good plan, and tell them why it's very important to lose weight. Then meals, dietary plans, fitness merchants, rewards and motivation merchants, lifestyle merchants, and sponsors. Those would round out the other categories of merchants that we want to bring to our platform. I'm going to talk a little bit about onboarding, why it's so important, and pause here and talk about the problems we're addressing. At the population level, many of you will know that Malaysia is the fattest country in Southeast Asia, with the highest prevalence of overweight and obese adults at over 50%. And that's from a 2019 study. That figure has most likely gone up, especially with the pandemic. We are also the sweetest country in Southeast Asia, with an 18% prevalence of diabetes in adults. So big double whammy there. However, and this is probably true at a global level, not just in Malaysia, it's not being addressed at the clinician level. And primarily, number one, because it's an awkward subject. It's taboo to talk about weight for some reason. It can be hurtful even in a family setting to talk about it, perhaps even more so, especially in a family setting. So what more in a clinician setting? And to be honest, there is no revenue opportunity, generally speaking, for the clinician unless they are an aesthetic clinic, right? But generally speaking, for most general practitioners, there is no real revenue opportunity, and that's a long line of patients waiting outside to see the clinician. So why spend 20 minutes talking about this? There's no real end game, no plan for the doctor to entrust anyway. So there's a lack of a trusted program to refer, not for lack of choice, probably because there's too many choices. And so the clinician cannot credibly just recommend one and put his reputation on the line. So, and lastly, of course, plans vary, budgets vary. It's really hard to recommend a plan to a customer if his budget is constrained. And some of these plans can be extremely expensive. So for various reasons listed here, at the most crucial level of dealing with this problem, we are literally firing blanks. We're not taking advantage of this interaction to properly deal with this problem. So what we try and do is to create a process, a scripted process through forms and through training and scripts where we adequately deal with this issue, and through a combination of motivation and education. And education in the form of explaining BMI to the user, and that's done on this table here on the left. BMI is well known in parts of the world, but there are parts of Malaysia that don't know what BMI stands for, and even more that don't know that we have an Asian variation of BMI. here in Malaysia. Basically, Asian BMI is required because we have correlations with comorbidities at an earlier level of obesity than Caucasians. So it starts from BMI 23 onwards, whereas the rest of the world would use BMI 25. So in a clinician setting, we would hurriedly, say, you would benefit from losing weight. Why don't we take your weight and your height right now? So anybody want to volunteer and tell me their height? So we can use this form in action.
Yep, sure. I'll step in.
Okay. What's your height?
My height is cm or feet? Are we
CM.
going?
Meters or cm?
Sorry, 167, I think.
Okay, so I'm not going to ask your weight, don't worry. So let's say you're 167, your figure would be here. Your optimal weight would be from 51.6 kilograms to 63.9 kilograms. So I would basically write 63.9 kilograms here, take your current weight here, deduct these two, put the differential here, and divide that by 2 to arrive at a number of months, because the responsible, very safe, conservative weight loss rate of 2 kilograms a month is recommended. So if let's say it's 10 kilograms, then you have 5 months to do that at that rate. And that's where we think this provides some level of motivation, a finite goal, finite amount of weight to lose, a finite period of time. So the user can say, yeah, I can do this. Maybe not tomorrow, I'll need time to think about this, but I can do this. And that's what we want to achieve with this form. If the user says, okay, I'm ready to go, then we quickly scan the QR code, get the data passport signed up, get the universal ID to fill this up, write the date, and have this email scanned or WhatsApped or taken a picture of and sent to us, and voila, she is a contestant eligible for these prizes. Trip to Turkey, Xiaomi, Fitbit, etc., etc. So this part of the collateral is more education and motivation. Motivation here in the form of fear, basically, and this is where the clinician or the tech or the nurse or the pharmacist would talk about long-term problems that will come from being overweight for too long, knee pains, diabetes, heart disease, hypertension, chronic fatigue. And this part we would talk about how you can reduce weight, but this is the part where we actually customize together with the merchant or the clinic to highlight his particular form of intervention that helps. So if, for instance, the client was onboarding at a mental health facility or someone with a mental health background, he could actually offer to reduce stress first, because it is well known that trying to lose weight is something that will gather your mind and your resources and your will. So you should actually be less stressed before you do it. Balanced diet, more sleep, reduce sweets, get moving. These are all things we can customize with the merchant to help on-sell something beneficial to the user. So we hope with that process, because we do believe that the clinical setting, the pharmaceutical setting is still the best place to strike the right amount of motivation, fear, or visual ambition of what you want to be. And so we hope to script that scenario as well. Basically, don't be angry. I can tell you that you will benefit from losing weight. Here's a free program with prizes. So revenue opportunity is there, because that you can offer a blood test if you're a clinic, or fiber protein supplement if you're a pharmacist, or whichever supplement has been approved by the local authority. It can be offered for sale. And it's a nationwide nonprofit platform, trusted, run by doctors, free to use, no budget issues here. And great, best of all, see you back next month, 2 kilograms lighter, a chance to see the customer again 1 month later. So we hope by that process, we have solved that clinical problem of facing up to the obesity. Thereafter, when he signs up, the user has in his phone a nice platform to view merchants that can further optimize his journey, personalized diet plans, foods that are low in sugar, fitness classes, fitness packages. These are just some examples. And I'm just going to gloss over these main slides basically because or maybe this is basically what we would report for the merchants. And here we will basically show them that on our platform, we will actually offer very, very detailed analytics of their reach, the audience that they're reaching, the impressions they're getting, the engagement, and even the transactions that are resulting from this engagement. And of course, naturally, through the algorithm, offers that are more popular or having more engagement would float up to the top and be seen even more. So with that in mind, future versions in our beta, we will be testing more things, tracking more things besides weight. We want mindfulness to expand beyond weight to your blood sugar, fasting blood sugar, blood pressure, and your resting heart rate, to your waist, how well you're sleeping, and of course, how many steps you're taking. Right now, we are in open testing with a goal on our MVP, with a goal to having 500 users testing for features for our beta web app, and also measuring traction and engagement with the app, and when it drops off, how it drops off, and how we can keep them coming back. We are also doing cohort testing with community leaders. The B4T, which is a Malaysian term for we basically divide the population into economic backgrounds, the top 20%, the middle 40%, and the bottom 40%. So the B40 means the lower socioeconomic background folks, and B40 community and M40 community. So we're doing testing, cohort testing for both these communities to get this data. These are our goals to our target markets once our beta is out, to reach 50,000 users by the end of 2022. Basically reflecting the country as a whole, 30% B40, 70% M40, 60% women, men, 30% non-Malay, 70% Malay. As you know, we have 3 main races here in Malaysia, but this is a statistic I really like to talk about, which is 1 to 4 ratio of participants and supporters. Really want to get the users' close-knit social network involved in this project of getting together better health. Who cares if you have 500 friends on Facebook? We really want to activate the 3 to 5 that can actually make a difference in your life, including your family. And that's actually one of the double meanings of our name, SejutaKG. Sejuta, as you know, means 1 million. Kg can mean kilogram, but in Malaysia, it means, it's an acronym for kampung, which means a village. So literally taking a village to make an intervention. As usual, the existing means of existing social media we will use to try and subvert distracting engagement and bring it back to be centered on the user and their health. We will, of course, use those plans as well. Let's bring them. So, here is a sample of a recent presentation of how we could benefit by working with a community cohort onboarding. These are the benefits we thought we could bring to the community, targeted to the most in need of weight loss, no cost, building mindfulness with community support even after events are over. And we try some new prizes. We are always experimenting with prizes, what makes people move, gets them excited. So this is a 4 kilogram weight loss over 2 months for prepaid cards for data. Data is quite scarce sometimes. And of course, still being eligible for the main prize of the all-expense paid trip to Turkey. So with a community call, we do need community leaders to step up and say they support this goal and they're concerned and they care for the people in that community. So that's the commitment that we will expect from them as well. And that's it. Yep, sorry, that's it. Thank you very much. I hope I didn't take too long. I'd be happy to field any questions anyone may have.
Brilliant. Thanks, Gabriel. I always love seeing it. It doesn't matter how many times I see those facts, it sort of blows my mind. Something to do with the NCD relationship to death. So I'm going to dive straight into questions because you have got quite a lot. So I'll tackle this one first because I think it's quite important to the core of what you're doing. So what's the decentralized element of this program? And what are the building blocks behind user experience? Do they get apps? How do you manage their credentials? So I think you've answered sort of the bit around apps already. But yeah, what's the decentralized element and how do they manage their credentials?
Okay. Okay, sorry. There's 2 question and answers windows and I was looking at the wrong one. Okay, can you explain the decentralized element of this program? What are the building blocks behind the user experience? Do users get an app? how do they manage their credentials? Oh, okay. So yeah. So okay, I'm not a Dataswift employee, but from what I understand, every user that signs up gets their own personal data store. That personal data store is a database on a micro server in the cloud. It's not owned by me. It's not managed by me. I do not have access to it unless it's by the consent of the user. When they choose to share their data, this usually in the form of data passes that they have signed up for. So, for instance, in the process of becoming eligible for our prizes, the user starts off as a participant, just an ordinary participant in SejutaKG. He gets upgraded to become a contestant, and therefore being eligible for prizes. And he gets a second data pass from there. And that contestant data pass becomes a separate data pass that is an identifier or attribute that he would like to share with others. So, for instance, if he goes to he sees an offer on the platform that says, free introductory class for SejutaKG contestants, he'll go to the shop that says, I'm SejutaKG, here's my QR code, verify me. And that's what he's transacting as well. Nothing else about his ID or his password. All he's doing is transacting his data pass as a SejutaKG contestant. So that's what I understand. Decentralized. I hope I got that right. The users get an app. It's a web app for now. Definitely beta, moving towards iOS or Android app. How do they manage their credentials? Not sure. You mean? I'm not sure. I'm not pretty sure you don't mean just editing their profiles. Is that what you mean? I'm not sure.
I'm looking. I've got two screens up as well. Which one is this? Q&A or the chat box?
Chat.
Here we go.
Basically, how do you manage their credentials?
Sure. All right, that's verified by the user, isn't it? By the looks of it. So I think that's a good question, actually. So do you rely on your users to be honest about what they're doing? I guess yes is the answer, because you're only defeating yourself if you lie about your own weight when you're trying to lose weight. But in terms of I'll link this to one of the other questions I like in here, which is how far. I mean, you've given some of the stats and metrics that you're going to expand into. But like as you grow the program, I'll make a phase 2 of that question for you, Michael, because I think it's really good. Are your ambitions to grow to sort of encompass a much larger sphere of health and well-being stats? So you've given sort of 5 initially, but do you see yourselves really getting big in terms of like helping people take ownership of that? And that's where the decentralized element comes in.
Absolutely. And I think I'm going to give away the ending of this movie.
You don't have to.
But basically, if we for most of the, I would say 80-90% of the users that come in would be overweight and obese. But when they hit the BMI 23 goal, I'm hoping we can completely reskin the whole app and call it something else and say, you have upgraded, you're now,
cool.
And we're hoping to either have a premium version of SejutaKG, which is, bells and whistles, complete health tracking of key metrics, or, we can just stick to the same brand because it's familiar, but basically an upgrade, to hit, you hit your goal. We want to congratulate you and definitely bring on board all the other things that would make you to better health, not just BMI. So yeah, for sure, definitely that's a goal.
Yeah. So with that in mind, sorry, there's a bit of feedback, but in terms of the credentials, as you grow, I love the way that you say apps can evolve, by the way, sort of like gamifying it, really the end of the movie, like you say. But as you grow beyond just weight, for example, as you bring in other credentials, how are you able to verify what they're uploading is accurate? Do you need to verify that it's accurate? Or
okay. So for the contestants in this prize, we know for the prize draw or all the prize draws, we actually only need 2 weigh-ins. One is the registration weigh-in, verified, done at the clinic or pharmacy, fine. And then at the close, wherever, if it's a 6-month contest, if it's a 1-year contest, then after 6 months, a second weigh-in at the end. So these two have to be done at official centers or clinics with a certain procedure, with confirmation, verification from a reputable source. Within those little updates, honestly, those are it's not necessary for the prize draws, but it would be very strange for you to just cheat yourself, because we're not actually using that data. That data is meant for you. It's meant to inform your journey, inform other people who can help you. It's the verifiable behavior that we were talking about was your friend or your uncle or your mom or your sister saying, "Can I see a screenshot of your graph?" And if you want to lie to her and lie to yourself, that's you could, but I wouldn't see the point of that.
That makes sense. So you manage. Oh, lots of feedback there. You manage your own credentials, and don't cheat yourself. Although we it's funny because we're working with a few other programs that actually we are introducing really interesting verification elements, but we can chat more about that at 2 p.m. UK time. So a couple other questions. These are really fun questions actually, just to do with the app. So how often do the prizes change? Great question. Do we always go to Turkey as a reward, or what else is happening?
So we have a very strict prize registration period and prize giving period, because we don't want irresponsible things like crash dieting or whatever. So for this particular year, you have to register and get your height and weight verified before June 30th for the prize draw on the first week of 2023. So yeah, very, very early closing period for a much later draw. Yeah, so you missed it, too bad. There's always one next year. Don't worry. So we may do one every half year if we find another great sponsor like a travel agency that sponsors it. So yeah, ideally it would be one every 6 months. So we have this rolling all the time. But why Turkey is because we have a primarily Muslim population here in Malaysia. Turkey is an endless source of fascination. People have gone there 3-4 times, especially on the way to Mecca for Hajj or Umrah. So very easy and acceptable destination for the majority of the population.
That's really cool. And I guess the other element to answering that question is the way data passports work. And I'll tie this into one of the questions here. What's the difference between merchants and sponsors? The way data passports work is, correct me if I'm wrong, Gabriel, because I've not seen your latest interface, but you match people based on their personal data attributes to relevant merchants. And that's a live just ad feed basically, isn't it? So for local gyms, discounted gym memberships, dietary foods at your local store, anything that helps them on their journey. Merchants pay to basically advertise within the app, and it's matched using data because it's decentralized data. So the data is not stored by you guys, it's stored with the user. Is that right? I don't want to mess it up too much, but yeah. So that's sort of a prize. I don't know if you count that as a prize. Maybe that's just part of the thing. Oh, lights are switching off here. On that note, so what is the difference between merchants and sponsors for you?
So sponsors are a super category of merchants. For me, they would preferably come in at all levels. So they will come in with a prize because they want their brands affiliated with our campaign, because it's a halo effect of doing good. They will come in with an offer on our platform. So depending on what the first one was and what we might give, say, unlimited listing on the offer for the platform for the whole year. So it's something, basically merchants have a cookie cutter offer. This is your offer, this is how you do it, this is how much you pay. Sponsors, we can customize.
That makes sense. Very good. The other question I like is, will you be using AI to better recommend plans and diets? That's quite cool.
That's cool. And I know some people working on that, but in a different area. I can't say I'm an expert, but yeah, if anybody wants to partner with us on that, that would be splendid. That would just create even more impetus for the user to be mindful and update and upload more data about themselves into their own little private personal data store, because that's just more stuff to interpret from there.
That makes sense. Just rattling these, I'll probably ask maybe 2 more questions just because we're over time. Just to say quickly to the folks listening in about 25 minutes, Irene, myself, Tyler are running sort of like a open one-stop shop. So Michael, you've plugged some absolutely brilliant questions. So I would suggest maybe showing up to that because we can answer those comprehensively sort of in a more live chat with you. But so keeping to the ones that are focused on you, Gabriel,
Sure.
How do folks download or use the platform? I mean, you said it's just a web app, or you guys?
It's just a web app for now. Yeah, MVP is just a web app for now. Yeah. So you can just go to our website.
I appreciated that about you guys actually, because I've worked with a lot of teams and apps over the years, and frankly, there's not that much phone space anymore. So like keeping it flexible and online is and especially if it's a weight loss program. So
exactly, yeah.
You're either dedicated or
everything is frictional, is what Irene said. Downloading an app is a friction that just stops the interaction for a lot of people. So we went with the optimal version.
Yeah. The one thing that I got years ago, no one does it. You can save web pages as an icon on your home screen, can't you, on your phone? I think you guys do that. And so it looks like an app, behaves like an app, but it's just a website. So you're not taking up any phone space, which is cool.
Yeah.
So one from Terry, he's on our team actually. You said that verification of weight is done at a pharmacy, so authorized party. Are you thinking of doing peer verification? That's a good question.
Irene Ng would like to answer this question live.
Oh no, that's us. That's just because the admin is Irene. That's you and me.
Okay. So, okay. So, I've not thought about this. Definitely for cohort onboarding, we go in ourselves and do the weighing and the height measurement ourselves. So I guess you could say that's a bit like peer verification. Not averse to it. It's just, I guess there's a certain threshold of confidence that we need to have in whatever process it is. And as long as we are confident of that, that's fine. Basically, a clinic, a pharmacist has their reputation to maintain, theoretically, and professional standards to maintain, certification and such. So that's why we are more welcoming of that idea. Unfortunately, Malaysia, scammers and gamers, people who game the system are plenty. So can't hold it beyond some people to try and game this too.
Yeah, that makes sense. I guess you could do it through partnering with third parties though, but that's technically not still peer system. I've seen some apps out there that use AI to scan photos and verify its reality. Maybe that's a bit too far out for the Malaysian market at the moment. But
we do have an online height and weight verification system. It's kind of fun. It basically involves you using a pencil, phone, measuring tape, scale, and a friend. So you can do it online. Line up against the wall, draw a pencil, measure the distance. It's very old school, but yeah, it's online. You can do it. It's free for now. So if you can duplicate that process, I think that's pretty safe and pretty secure. Yeah. The other way we could do it was we thought of a toe feed instead of a selfie or a Wi-Fi. A toe feed, a camera pointed at your toes on the scale. Yes and no, maybe. There was one. I saw some apps that actually kind of guess your body weight composition and your weight just from a photo.
Yeah, I've dealt with a couple of those in the past. I'm not sure how successfully they scaled.
Yeah, I don't know.
You did a little bit more metrics than that. But, adding to what you've said there, I think one of the things I really appreciate about what you're doing is it's so accurate to your market. So like you being a web app, you've entered at the entry point with zero friction. You're doing mass coordination of the entire Malaysian population. I don't think you'll have 55,000 users by the end of the year. I think you have far more.
I need my beta out for that.
Yeah, no, I think you'll. Yeah, I just feel it's so good because it keeps things simple enough for entry, and then as the market grows with you, because you're mass coordinating an entire population, you can then step up the features on the app, which are pretty simple.
Absolutely.
I'll ask one more question. What are the others here? So, there's two. Is there an age restriction? That's a great question. That's more about, I guess.
Yes. I believe the correct answer is whenever you can start applying BMI.
Okay.
I know you can't apply BMI for something like below 18 years or something. I'm not sure. So sorry, I'm not sure whether it's 18 or 21, but basically that's the restriction.
That makes sense. So it's self-selection. And then finally, can you record your COVID status in your platform? That would be a great addition.
That would be a great addition. Absolutely. Thank you very much. Yeah, that would be great.
So you've got some great ideas here. Guys, in all seriousness, if you want to chat to Gabriel about this, we can provide you guys his contact details, because I think this is possibly the first platform I've seen in the world where you're integrating a community around weight loss. It's not just the individual. You've got supporters joining the campaign, and they're incentivized to do so because you're seeing discounts within the ad matched directly to you. So it's like Instagram on steroids, which is pretty powerful stuff. But yeah, feel free to ask us to get put in touch directly with Gabriel. COVID pass may be coming. We at Dataswift are actually working, we can't share the names, but we're working with governments and other folks who will be coming out with universal accounts for things that go way beyond COVID passes, but include
excellent.
So,
excellent.
Anyway,
very exciting.
Pleasure chatting to you, Gabriel. It's good to see you again.
Thank you so much, Beck. Good to see you again. Thank you.
Hopefully I can come over to KL fairly soon, but we'll see.
Please do. Yes, it will be soon.
All right, and for those of you left on the call, as mentioned, I believe I'm in Singapore, so I'm just trying to do the head maths. I believe it's 20 minutes, so 2 p.m. UK time. Tyler Weir, our CTO, Irene, our CEO and founder, and myself, Chief Strategy Officer, will be just having a general chat about PDAs, PDSs. Firstly, obviously clearing up the terminology, helping folks understand the different acronyms, I'm sure. But beyond that, actually figuring out, okay, Gabriel's got a fantastic business here. How did that happen? What are the technicalities of that? So we're more than happy to answer questions around that and how we integrate with folks and what that looks like. So see you in 18 minutes.
Okay.
Cheers again, Gabriel.
Thank you, man. Take care.
Bye.
Bye.